And when the state legislature reconvenes in January, one of the other bills lawmakers will consider is one that would allow students to take one mental health day as an excused absence per semester.
So to talk more about that, we're joined by Derry Hulkow, the primary therapist at Arete Recovery. Derry, thanks so much for being with us. You think this is a great idea. How come?
Well, I think it's necessary. Mental health days is a matter of public safety and public health. So having mental health days off for students can help improve the safety of the community and the students individually. It can help improve their physical health, their emotional health. It can also help improve productivity in the classroom and later on in life at work.
Explain the concept so we understand a little bit better, like what sort of incidents would lead to a parent, I guess the parent would call the school, right?
Yes.
And request a mental health day. Give us some examples.
So for example, a student is going through a difficult time or just chronic stress, overwhelmed. Students these days face academic demands, face social pressure, face family conflict, personal struggles. So any day where they feel like it's necessary for them to take a self-care day just to process or talk to a therapist or just rest and get some clear mind, it's important that they have the opportunity to have a day for that kind of care.
So if the goal is to take the stigma away from mental health, why even call it a mental health day? Why not just have the parents say, hey, my child is staying home from school today?
Well, it is definitely a great initiative to raise awareness as the importance of mental health. It can definitely be as important as physical health, if not more important, arguably. And not only can help, like you said, eliminate the stigma or reduce the stigma on mental health conditions such as depression and anxiety, it can also help prevent substance abuse problems and potential crisis situations.
And this is a bigger concern now than when many of us went to school, right? Because of social media. Talk about that a little bit.
Yeah, so I mean, we've heard the news about drug epidemic, we heard the news about suicide and cyberbullying and mass shootings most recently. So definitely those struggles are newer compared to when, you know, three of us went back in school.
So we know about the mass shootings at the schools, and we know that a lot has been done to improve situations in terms of security for our children, but what's still not being done?
More education, more emphasis on taking care of our health, not just during a crisis moment, but on a daily basis. Mental health could be something as simple as taking care of ourselves, being able to communicate and express our feelings in a safe environment, being able to create healthy relationships at work, at home, in the classrooms.
So finally, what would you tell those skeptics out there who say, no, I want my kid in school. I don't want him missing out another day of school. What would you say?
Absolutely. I want my kid in school as well. But definitely there's times where they do need time for themselves, whether, you know, if there's, again, physically sick, they need to go to a doctor, take care of themselves. If they're emotionally or mentally struggling, they need time to recover and heal.
So as parents, we really need to be tuned into our kids and know when they need that kind of day.
Yes, definitely.
All right. Derry Hulkow, thank you so much for being with us today. Such an important topic.
Thank you so much for having me. I appreciate it.